Dr. Warner, can one die from asthma?
Certainly one can die from asthma, but I don't think asthma should be thought of as a disease that kills people. It kills a very small fraction of asthmatics, although unfortunately, the rates of death from asthma are increasing. I read somewhere that 1 to 2 in 100,000 individuals in this country will die of asthma this year. So compared to some of the other diseases that put them at a higher risk, asthma is not really a lethal disease. However, it's a disease that causes exceptional morbidity for individuals, because it's so common, and we heard numbers anywhere from 5 to 10%, and in toddlers in the early childhood years, I've seen numbers as high as 30% of toddlers having wheezing episodes. So it's a very common disease, and so the impact of the morbidity of this disease for individuals is very high. And as Dr. Wasserman mentioned, there's so many good medications, it really doesn't need to be as high as it is.
Dr. Venkat, where can one get more help in treating asthma conditions, dealing with it in some form? Yeah.
The first help that a patient should get is really their primary care physician, because the primary care physician is the one that would recognize, and help the patient in diagnosis of asthma. And once the asthma is diagnosed, then the person can have an appropriate pharmacotherapeutical regimen instituted, as well as perhaps environmental control, which is a major aspect of treatment of asthma, instituted. And then if the primary care physician feels that this particular patient with asthma needs further care, then we have specialists, in allergy and asthma, who could be an allergist or perhaps a pulmonologist who also takes care of asthma. I happen to be an allergist, and when I see a patient who comes in with asthma, besides taking a history and a physical and diagnosing the patient with asthma, it's important to find out and let the patient know what the triggers are. And once the triggers are found out, then we can give the appropriate treatment, which would be environmental control and pharmacotherapeutic. The other help, there are various national organizations and national associations that are there that is an adjunct to the treatment that is given by the patient for the patient. One would be the American Lung Association, the American Academy of Allergy and Immunology. Dr. Wasserman was the president of the Academy, and we have the phone numbers. I think you could probably provide it to the audience. And the American College of Allergy, the National Mothers of Asthmatics. These are various organizations that are around for the patient, which gives patient education and helps the patient in the right path for asthma.
Thank you very much, all of you experts. Dr. Wasserman, have you any final message for the panel?
Yes, I think I do. I think the message would be that asthma is a common and non-trivial disease. As Dr. Horner mentioned, it's not a disease we think of like cancer that's going to kill people or heart disease, but it's a disorder that really interferes with normal life, and it interferes with that in both children and adults. And the most important message is we have good treatments for asthma. Asthma should not be trivialized, and people should not constrict their life around their asthma, but instead should seek medical attention and should use the excellent medications that we have now. And with appropriate medication, appropriate environmental instruction, almost everybody with asthma can return to a full and normal life. Restricting activities is the last thing that one should do.
Okay. Thank you very much, every one of you.
Thank you.
Thank you.
We will now continue with our second question and answer session, and we already have a caller on the line from Tecamac, Mexico. From the Universidad Tecnológico de Tecamac. Go ahead, please.
Buenos días. My question is the following. Just as right now we have inoculations to prevent illnesses in people, diseases, if we have illnesses like asthma that are genetic, what can we do to prevent these kinds of illnesses and diseases affecting people when they're already in the womb? So what can we do as far as genetic prevention?
Well, there certainly are studies that suggest that breastfeeding is very good for children in a million different ways, and some of those studies suggest that in terms of asthma, that breast milk may be protective in terms of reducing the incidence of asthma and the incidence of other allergic diseases as well.
Any other responses to that very good question?
It was an excellent question. I think the lady was probably wanting to find out a little bit about what is called as the hygiene hypothesis that was mentioned a little earlier. Basically, it means that if a person is exposed to bacterial infections when you're young, the chances of getting asthma probably later on in life is a little less because of the tilt towards the T system, the T subset system, towards the infection rather than the allergy part. But breastfeeding, as Dr. Tony mentioned, is more important than anything else, and the hypothesis is still not very clear, so one should not be based upon that in particular.
The other thing I should chime in on is that the predisposition to developing asthma and other allergic diseases is inherited. However, people are not born with any of these allergic diseases, and not only do certain types of infectious exposures protect against asthma, but reduced exposure to known high-risk allergens like house dust seems to at least postpone the development of allergic diseases. So there are things that can be done right now in terms of the environment and in terms of breastfeeding, and we're looking forward to in the future having some newer approaches to prevent these diseases in people who come from the genetic background that puts them at high risk.
So it's a classical interaction between genetic predisposition on the one hand and these environmental and health factors on the other hand.
Absolutely.
All right, we have another caller from Havana, Cuba. Welcome from Sitmatel. And go ahead from La Habana, Cuba.
Good morning, everybody. Congratulations on this very interesting topic, and which is very current as far as stress in the workplace. And my question is the following. The stress that is motivated by abnormal conditions in the workplace as far as contaminated, polluted air, fumes, powders, and dust that can lead to chronic asthma, as you have said in this panel. Do you think it would be justified to consider asthma as a professional type disease, and in which case what kind of how are we addressing this? And how has this been addressed in your opinion and in your experience as a professional disease, and legally and professionally speaking?
Okay, asthma is a professional or organizational disease. Interesting.
It is an environmental disease because of the precipitants we talked about earlier, and the same environment can be there in the workplace as well. So in that particular regard, it can be considered as an occupational precipitant. So all the things what we mentioned about how to prevent dust, pollen, powder, mold, and increased humidity in the workplace should be utilized. There are several appliances like air conditioning or furnaces, and different things can precipitate a bronchial asthma because of either increasing the humidity or increasing the toxic materials they emanate. So all these things are definitely factors, but in the United States we have a lot of regulations and laws against pollutions. So in different parts of the different countries, the public should go through their legislation to implement these kind of safeguards in their industries.
Good, very good response. We have a caller from Mexico, from Culiacan, Sonora, from the Instituto Politécnico Nacional. Go ahead, please, from Sonora, Mexico.
Sí, muy buenos días.
Good morning. Do you think that asthma in Latin American countries is a problem, a public health problem like in the United States? And what elements of research do you have as far as these countries?
I think asthma is a problem worldwide, some areas being harder hit than others. It certainly is a particular problem to the urban environment versus the rural environment, and cities like Mexico City have huge problems with asthma, as do urban cities in the rest of the world. So yes, it is a major health issue in Mexico as elsewhere.
I would definitely add it is a public health problem probably in Latin America too, because education is an important aspect of asthma, and it's important for physicians who are taking care of patients with asthma to make sure that they educate their patients and let them know what is it that they have, and put them on appropriate medications and monitor them carefully.
Well, speaking of bad air in Mexico City, our next caller is from Mexico City, the Dirección General de Educación. Okay, actually we don't have that caller. We've lost that caller. All right. Instead, we have a caller from right here in San Diego from the California Distance Learning Health Network. Go ahead, please.
Hello.
Hello.
Yes, I didn't know if I was on.
Yes.
I'm wondering what can be done by employers specifically to provide a workplace environment to minimize allergic and asthma attacks and thereby help increase overall productivity.
Okay, specific things employers can do.
That employers can work towards.
The one thing that probably an employer can do is, based upon what kind of environment it is, they could provide masks, to the patient if the patient has severe asthma or allergic rhinitis that contributes to the asthma, and create a safe and a clean environment. Perhaps providing air purifiers, which are HEPA systems. And again, it all depends on each individual environment that the person may be exposed to. It varies with person to person.
These days you see many of these leaf blowers blowing dust into the environment and emitting gasoline fumes. Are those a bad idea for asthmatics and people with allergies?
Gasoline fumes certainly would be a trigger for asthma, and certainly one would want to avoid any kind of extra triggers, whether it is gasoline fumes or diesel fumes or cigarette smoke. Any of these are triggers for asthma.
I think the other thing that should be touched upon is, along with the things that employers can do in the environment, of which many have been mentioned, I think a level of sensitivity and concern by employers with regards to allowing their employees to go to regular checkups for preventative management of their disease, a level of concern that employees with chronic coughs or other respiratory issues that are persistent in nature deserve attention, to encourage that those types of symptoms get addressed, I think also would be quite helpful, because there are a lot of people who have asthma who don't even know it.
Some good specific questions there. Now, we have another caller from Mexico, from Chihuahua, at the Gobierno del Estado de Chihuahua. Go ahead, please, from Chihuahua, Mexico.
The question is the following. An allergic person, what possibilities does that person have, or probabilities of actually getting asthma, or will that person not necessarily develop asthma? Thank you.
It's a really good question. I think the genetics of asthma comes into consideration here. If there are two parents who have allergies and asthma, the chances of a child having allergies is about 80%, 60 to 80%. And on top of it, if the person is exposed to various indoor allergens, in infancy, for example, pet dander, saliva, urine, or molds or dust mites, they are important triggers.
Now, when my daughter was little, they advised us not to feed her cow's milk because I have allergies. Is that still good advice? Mother's milk, artificial soy-based milk's better than cow's milk?
Well, actually, I would not say that soy-based milk is better than cow's milk. You know, the first thing that I would do with such a history is breastfeeding, as the other physician mentioned here, because that is more important. You can get soy milk is also a protein, and about 30% of the children who have milk sensitivities are also allergic to soy. So I would definitely check with the physician before turning the kid on to having soy formula.
I was going to say the bottom line is people develop allergies to what they're exposed to. So the reason that people have milk allergies is because they drink milk. If everyone drank soy milk, we'd probably see soy allergies are having the same frequency that we now see cow-based milk.
And particularly what they're overexposed to, is that right?
There's a lot of debate about this. It's a very complicated question. And getting back to the question at hand, though, not everyone who's allergic develops asthma, and it's very true that genetics seem to play a role in terms of which allergic individuals suffer from nasal allergies and which individuals suffer from asthma. It does appear, however, though, that proactive intervention for chronic allergic conditions is protective against developing more chronic allergic conditions. So in this particular case, an allergic rhinitis patient who's aggressively treated for that particular problem potentially will not go on to develop asthma, as opposed to someone for whom intervention is not provided.
Okay. Now we have a question from one of our neighbors in Sinaloa, Mexico, from the Secretaría de Educación Pública y Cultura del Estado de Sinaloa. Go ahead, please.
Sí, buenos días.
Is it possible to have certain therapies with animals to counteract asthma and to eradicate it? Because we hear that sometimes children are, doctors recommend children to have an animal, a pet, like a chihuahua, for instance, of certain races, certain breeds, because they supposedly relieve some of the asthma or allergic conditions of the child.
So pets help or hurt asthmatics?
You know, it's an exceptionally interesting question, and it sounds like this woman has been reading the scientific literature, because the old dogma was, and it still is, you develop allergies to what you're exposed to. House dust, pets clearly provide very allergenic materials, and a pet exposure late in childhood does in fact seem to be related to pet allergies. Interestingly, children who are exposed to pets early in life, and there's been some studies now with cat, seem to be protected against cat allergy, and it sort of goes against previous dogma about exposure to pets and pet ownership in allergic households. No one's pushing individuals to get pets at this point because we don't understand this paradox, but it does appear that pet ownership earlier in life may prove to have some protective influence on the development of allergic diseases. With regards to breeds, however, certainly in the scientific community, we think of pets as allergic if they're mammals, if they have hair, and even the nude cats that people used to think would be hypoallergenic are not. So as far as we're concerned, if it has hair, it's got the potential to cause allergies. So I wouldn't worry specifically about breeds.
And also the other thing is it's not really just the hair that is the allergen. It could be the saliva, it could be the urine, and there are other allergens. So, you know, pets are pets, basically.
Talking about pets, the children who are exposed to toys, pet toys like, bear, teddy bear, or something like that, even those things can have allergens in that.
Well, they harbor dust and dust mites.
Particularly dust mite, yeah. Dust mite. So it's important that not only we wash the pets, but also the pet toys frequently, so that we can avoid dust mites.
Okay. We have another caller from Sinaloa, this time from Colegio de Bachilleres Estado de Sinaloa. Go ahead from Mexico, please.
I'm calling from the state of Sinaloa, Mexico, and we would like to ask the following. The psychological problems can unleash certain asthma attacks. Is that possible?
Psychological problems, stress, and asthma.
That's actually a very good question. Psychological problems do not cause asthma, but as she said, unleash asthma. It's an important aggravating factor of asthma, and it's important to pay attention to stress and asthma.
Now you hear that exercise often induces asthma, and there's a particular kind of asthma called exercise-induced asthma, but for many people, including myself, running and other forms of exercise seems to help. Well, what about that? Is exercise a benefit or a detriment?
That's actually a very good point. You know, we definitely want our patients who have asthma to be stable enough that they're able to perform all the activities that they can because of their mental health, mental well-being, as well as health. It's important to exercise on a regular basis. Asthma as such has one aspect of it, which is exercise-induced, and also there's a separate entity which is called exercise-induced asthma, which probably is caused by the cold evaporation of heat due to energy that you are producing, causing the coldness and neurological reflexes to act up to cause bronchospasm. But of course, we do not want patients not to exercise. We want them to be stable enough and treated well enough that they can exercise.
Got it. Okay, here's a local question right here from San Diego, from the California-Mexico Health Initiative. Go ahead, San Diego.
Hello.
Hello. Welcome. Hello. Go ahead.
Yes, my name is Gloria Sotelo, and I'm with the California-Mexico Health Initiative. And I would like to know if you have any information about the relation between asthma and pesticides, basically in farm workers and their families.
So pesticides and asthma, particularly in farm workers.
Obviously, pesticides aren't good for a million reasons. It does seem that there are some links between pesticide exposure and the development of a lot of immune-mediated diseases, and asthma is one of them. We don't completely understand the relationship, but I think pesticide exposure is certainly not a good thing for asthmatics. In San Diego in particular, we found that the highest incidence of hospitalization doesn't actually occur in our inner city environment, but seems to be occurring in the farming communities in Imperial Valley and in El Centro area.
Where the air quality is bad.
Where the air quality is bad, but probably for different reasons than in an inner city. And although we don't understand that.
All right, I'm told we have time for one more question, and this is our caller back from Mexico City, from the Dirección General de Educación Tecnológico-Industrial. Go ahead, please.
Gracias. Good morning. Thank you. Our question is referred to the first module. How can you measure productivity in the educational sector, whether in a school or in a university? Because we have 429 different schools, actual facilities.
Okay, the question is, how do you, this is back to our first segment, how do you measure productivity in an educational setting? Can you benchmark that?
Okay. Yes, productivity is always very difficult to measure. Productivity is a ratio of output over input, and you have to measure what is being measured in the output side and what is being measured in the input side. The inputs can be related to the academic part, the non-academic part. It could be related to direct costs, indirect costs. In each one of these areas, for example, supplies, which are equally important for industries, also important for academicians.
Okay. All right. Thank you. We're just about out of time. Thanks throughout Latin America and the United States for your excellent questions. We hope you've enjoyed, once again, participating in this exciting, multilingual, multinational program. We invite you to participate in the 6th video conference of this series, the New Network Organization, its Enabling Technologies, Modalities, and Development Strategies. We would like to extend a special invitation to CDL-HN's sites in the United States to continue participating in the International Training Centers program. For additional information on this video conference series, please consult your participants manual where you will find dates and specific topics for each program. You may also visit our website, itcgroup.org. On behalf of all of us, I thank you for your enthusiastic participation and interest in today's program. Thanks again, and see you again soon.